Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Stony Brook Children's Hospital. You will recognize her to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, we always want to hear from you. This is a call-in show, so call us. The number right there at the bottom of your screen, 516-393-1800. All right, before we talk with our esteemed doctor and start taking your calls, it is 7 o'clock. You know what that means. News 12 Long Island would like to join the rest of the nation by clapping because we care. This is our way of saying thank you to all of the essential workers out there. So thank you, Amanda and Matt from Port Jefferson, both physician assistants at Mather Hospital and newlyweds. Congratulations. And thank you, Megan from Massapequa Park, who works on the ER at Southside Hospital. And thank you, Yexi from Farmingville, a nurse at St. Charles Hospital. Thank you, Monica from Port Jefferson, a PA at St. Catherine's and New York Presbyterian, that's in Queens. And thank you, Angelia from St. Charles Hospital's ICU. And thank you, Angelo, a UPS driver. And thank you to the entire crew at Dairy Queen from Medford. There they are. Thank you very much. And thank you, Jervin, store manager at the Montauk IGA. Also, thank you, Joe from New Hyde Park, sales rep for Arizona Iced Tea. And thank you, Ashley, an RN at Winthrop Hospital. So are you a nurse, a doctor, grocery store employee, restaurant worker, dry cleaning employee, bus driver, MTA employee, any kind of essential worker? We want to hear from you. Send us pictures of the essential workers in your lives. And all we need is a picture, the person's name, the village, hamlet, or town, and what the person does for a living. And every night at 7, we're going to be thanking the people who have been on the front lines during this pandemic. Just go to News 12's Facebook or Twitter pages. Now, there is a glimmer of hope today as Governor Cuomo announces that it appears the numbers are beginning to tick down and we may be on a descent. That's what he said today. Hospitalizations are down. We had the lowest single-day death toll in more than 2 weeks. He says the question is how long and how steep is this descent? Nobody knows that yet. Large-scale statewide testing begins today to see who has antibodies to COVID-19. The 3,000-person finger prick test will be conducted randomly statewide. The state health department would not say exactly where it's recruiting test subjects. However, Long Island officials say there will be tests taken here on the island. And the governor says it's not so much reopening New York, but rather reimagining the new normal post-COVID-19. He announced the Reimagine Task Force. That includes both the Suffolk and Nassau County executives. The panel will work on a plan to reopen New York's businesses and schools, primarily focusing on downstate New York, where we're the most hardest hit. In Nassau, help for homeowners and businesses. County Executive Laura Curran now considering a bill passed by the Nassau legislature that would give taxpayers until June 11th to pay property taxes without interest or any penalties. Now, just before that vote, she announced she had already asked Governor Cuomo for an executive order to extend the property tax deadline, but only to June 1st. The legislature voted for June 11th. Now, struggling small businesses could be getting some much-needed relief as well. The White House and Congress are expected to reach an agreement today or maybe tomorrow on a $450 million deal that'll boost the small business loan program. It ran out of money last week. And some frustrated small business owners here in the island say they were stiffed out of stimulus money the first time around. They're now demanding they see some cash this time around. So the House could vote as early as Wednesday on that. We'll keep you informed. All right, let's get to our discussion. Joining us tonight, once again, Dr. Sharon Nachman, Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Appreciate your time as always, and thank you. We've been thanking all of the heroes, and you're certainly right there at the top of the list because you're right there in the front line. So thank you very much for everything that you're doing. Let me start by asking you. The governor says the numbers are coming down. Nassau County Executive Laura Curran says you've seen about a 15% drop in the numbers, maybe a 30% drop. Are you seeing that at Stony Brook?
Absolutely, we are definitely seeing that. Importantly, we had an emergency room annex, which used to see several hundred patients a day. Over the past few days, we've had much less patients coming through, and that translates to many fewer patients having COVID symptoms requiring care. Granted, our emergency room is still full, so we're still seeing a lot of patients that are ill, but the numbers are absolutely down. Okay,
and so we just don't know how steep that's going, as the governor said today. So we don't know how fast it's going to go down, right?
It's actually more than that. It's not just how fast it's going to go down, But with everyone saying, oh, we're done with COVID, and perhaps going out, not maintaining distances, there is a real concern that those people who have been isolating will now be at risk, and we will see a second bump. When it's going to hit and how hard it will hit, we just don't know.
Okay, that's something to keep in mind. That's great advice. All right, let's get straight to the phone lines right now. We have Terry from Long Beach. Terry, you there?
Yes, I am. Good evening. How are you?
I'm doing great. What's your question tonight?
Okay, so good evening. Thank you for taking my question. I'm an RN and administrator of an agency serving adults with autism. As we know, when individuals are living in congregate care settings, there is more susceptibility in terms of the virus spreading rapidly, and therefore we were very concerned about early detection, early quarantining, especially with individuals being turned away for the testing if they were asymptomatic, and also given the length of time it takes to obtain the results of the swab test. We had chest x-rays performed on our residents confirming pneumonia in many cases, which is known to be consistent with COVID-19. And many of them did not have any symptoms at all. So the early detection also allowed for the use of the Z-Pack. So we know that COVID-19 is viral. We found that the Z-Pack prescribed along with the diagnosis of the pneumonia early on prevented further lung pathology.
Is there a question? I know.
Okay, so I'll jump to the question. So my question is, why are we not utilizing chest x-ray as a diagnostic tool for early detection, especially since there is a shortage of tests?
Okay,
people
doctor?
are being turned away, yes.
So I can say right now that we are not turning people away from testing. If you recall, at the height of the epidemic, we were going to the peak. We in fact did restrict testing based on symptoms and how many tests we have. We have many more tests available now, and we are not turning people away from testing. Generally, we tend not to want to use chest x-ray as part of routine checking as to who has COVID, rather restricting chest x-rays for those who need it, perhaps those who are going into the hospital. So from a bigger perspective, what might have been done a month ago is probably not as important as what we are doing now, which is better testing. We're certainly getting results back within that day or certainly within the next day, and restricting antibiotics to those who often need to be admitted to the hospital as opposed to routine, almost prophylaxis, which we feel may not be so helpful. So perhaps what was done in the past might be different to what we're doing now.
Okay. Mary from Lynbrook. Mary?
Yes?
What's your question tonight?
Okay. Thank you very much for having this half hour for questions, and thank you, doctor, for taking time. This is kind of a small question, but an everyday, several times a day kind of question. Women who are wearing makeup, how should they clean their makeup brushes and sponges? Which led to the question of hairbrushes. And should they be cleaned, and how?
Oh, those are great questions.
And actually, then one of my friends popped up with his beard.
Okay.
And is having a beard, you know, a sanitary thing. So it's hair day, doctor.
Oh.
Great, I'm ready for that one. So the answer is quite simple. The first and most important thing is obviously not sharing your makeup with anyone. Certainly that would be a bad way to start. Hairbrushes and hair really should not be keeping COVID virus around. So if someone is concerned after they brush their hair, I certainly think rinsing out their brush would be a very easy and appropriate thing to do. With makeup, I think using Q-tips that are disposable, if possible, would really also help. But these are all in the face of someone who has COVID. Someone who does not have COVID and is not ill could do their routine practices as they've been doing beforehand. The beard, if washed in the shower, shampoo, conditioner, it should not pose a risk to anybody.
Okay, let's try to squeeze in Elizabeth from Huntington.
Yes, hi. Thank you for taking my call. My question is, how necessary is it to disinfect every single piece of grocery that comes in now that masks are required in the grocery store? And is it necessary to be changing your clothes and coat and shoes as soon as you come in and wash everything?
It's a great question. I think with routine wearing of masks and gloves for everyone in the grocery store, we probably have a lot less need to wash and wipe all of our materials that we come home with from the grocery store. I must tell people that if you buy groceries and you put them in your refrigerator or your freezer, the virus will die, and by the time you get to those groceries and touch them, you will have no issues. The issue with changing your clothing was more of a general issue because we couldn't be sure who you were coming into contact with. So now that the stores are doing a great job wiping down handles, everyone's wearing gloves and masks, there's probably less of a need to completely change your clothing when you're coming into the house. On the other hand, washing vegetables, as you did in the past, is always still appropriate. Anything you're going to cook with, I certainly would want to wash, not for the COVID per se, but for other pathogens that we know are often transmitted in vegetables and fruit. So that stuff should still be washed.
Okay, let's try to get Tom from East Setauket. Tom?
Hi, how are you today?
Great.
And I would like to thank all of our essential workers for everything they've done. They've done a fabulous job. But I'm an automotive mechanic, and I work in a dealer. My problem is that when we get into the cars, sometimes people leave the blowers on, and we have some we put over the seat and a cover on the steering wheel. But unfortunately, with the essential workers that went back to work, they're only telling us that we only have to wear dust masks. So the owners or whatever will not be buying K95 or N95. And as it gets hotter out and you start to perspire and the sweat runs into your hair, if you have any contamination from inside someone's car, can you get it that way?
So we have not seen the virus sitting around in sweat. Granted, we haven't necessarily tested it so much, but I can tell you the paper mask that you're using for the brief time you're within the car is perfectly reasonable. If you're really concerned, I want to say, as silly as it sounds, the more exchange of air you have in the car, that would be helpful. So if you can open the windows, that certainly would be really nice. If you are worried in any way that there may be some virus still floating around in the car before you get in, open the doors and open the windows for a few minutes before you take that car and do any work on it would be helpful.
Okay, we're going to take a quick break, be back with more expert advice on how to keep you and your family safe from the coronavirus. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Sharon Nachman, Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Before we get back to the calls, I think our viewers might be interested to know, what do you do? I mean, we all are stuck at home. There's a lot of cabin fever going on. What do you personally do to keep your energy up on a daily basis?
Well, believe it or not, I actually like to ride my bike, and I'm happy to see there's lots of bike riders out there doing the same kind of thing.
And I guess we should point out, because I've seen a lot of adults not wearing helmets, that's a very important thing to go on right now, because that could cause a medical issue as well.
Right, routine safety things are always important. You put a seatbelt on when you go to drive the car, and your children and you must always wear a helmet, because the last thing we want to see is an adult or a child who's fallen off their bike and have had trauma.
Yeah, absolutely, great advice. Let's try to get Natasha. Is Natasha there?
Yes.
What's your question tonight?
My question is, well, the other day a bumblebee was buzzing around my head, and I was wondering if insects could cause the COVID-19 and transfer it to people who have no symptom whatsoever, and if so, should I go directly to the hospital?
So the answer is a simple, easy, you're safe. None of the insects, not the ticks, not the flies, not mosquitoes, and not bees, can transmit this infection. The only way to transmit it is really from person to person, or something that someone has touched and someone else touches it. The bees and the mosquitoes, thankfully, will not be transmitting this virus.
Okay, good. How about Yvette from Hicksville? Yvette?
Hi, I'm calling because I wanted to know if a person is infected with the coronavirus, okay, and then quarantined for 14 days, and then they don't have any symptoms, do they need to be re-swabbed before they're let out of quarantine?
In the best of all worlds, it would have been really great to have a test that shows, okay, you're out of quarantine, you're carrying no virus, you're fine. Unfortunately, we don't have that great test. Originally, there was a recommendation to swab those people who are coming out of quarantine. We are no longer doing that. We're not recommending that they be swabbed. We're just saying, great news. You follow the directions, you follow quarantine. It's 14 days, you're allowed out.
Oh, great. Megan, are you there?
I had a two-part question. My son was in Stony Brook Children's Hospital for 2 different visits in both December and January. My question is the Children's Hospital all COVID units now, or is there a place for children if they get hurt and need services that they can be? And if so, what is the policy for their parents? Is it only one parent coming in? Can they stay there? Are they allowed to come and go?
So the Children's Hospital is absolutely open for business. While we have some patients with COVID, we have a huge amount that don't have COVID. And like other institutions, we're following recommended practice of one parent, the same parent coming with the child, staying with the child, and coming and going. We strongly recommend that you come and stay. And the new Children's Hospital has beautiful rooms, and I know that the parents and children are there and they're using them. So be assured that we do have non-COVID patients, and we are absolutely open for business.
All right, let's try to squeeze Edwin in. Edwin, you there?
Yes, I am. Thank you for taking my question. I was just wondering, I've seen recently on the internet about the BCG rumors and whether or not this BCG vaccine that was given out back in the late 60s here in the U.S., any kids of military families or that kids that may be going overseas with their parents that were in the military.
Okay.
But,
let's try to get the doctor to answer the question because we're running out of time just a little bit.
Is this a rumor about this vaccine having any effect on this virus?
So right now, it's somewhat a rumor. There's actually been no studies to show that if you gave another BCG vaccine, you would boost somebody's innate immune response and in fact protect them from COVID. It's hypothetical, and that's all it is right now.
Okay, just a rumor. Doctor, let me ask you this. Are you seeing, speaking of rumors, do men have more severe, typically, symptoms than women?
Well, interestingly enough, I think that they do. I think that when you look at the numbers at Stony Brook, we see many more men than women being admitted. We see many more men being put on ventilators, and it doesn't matter almost what age they are, both in the older men as well as the younger men.
All right.
So there may be something there.
All right, well, that's not what I wanted to hear, but thank you very much. And again, thank you again for your time. You are a tremendous warrior and hero, and we appreciate everything you're doing every night and then coming on here and giving us public service.